Hi everyone. So we are live. So we are at that time of the year, I guess, where you can see the exam a little bit far. You can see the exam like somewhere here maybe, and you are here. And some of you might be here, some of you might be here, some of you might have just missed the bus, right? So at the end of the day, time-wise, we still have two exams to look forward to: the NISS and the NEET SS. And varied stages of exam preparation and varied strategies to look forward to, right? So we're going to discuss all of that in various scenarios, how to proceed. And also, more importantly, the main question, especially with respect to SS, even more than NEET PG to some extent, is how much to read and from where to read. So right, we'll
Yeah.
be going through that. Yeah. And
So
yeah.
yeah, go ahead, go ahead. I'm so sorry, I missed out you.
Yeah, so we'll be looking at little bit of the current paper which we've been discussing. We've been doing the recalls because NEET SS is not a very predictable paper. The best reflection is not the previous paper, nor the 2 years, 3 years. It keeps changing, and that was how it was this time. Also, it was very uneven. Peds cardio went up a lot. Peds onco, it's always important, but that was compared to usual a little bit more. Gastro for some reason was quite high compared to previous years. Neonate is always there. Nephro also little bit high, while the other parts which are usually dominant in the previous years, like Peds General, Peds Critical Care, Genetics was a big block in your 2021 paper that came down. Right, and Rumat usually it's not so many questions. It's maybe like 5 6 questions, but this time it was 11 or some 10 11 questions, 10 12 questions, right? So it was again very erratic, and also the block wise pattern which was there this time, those block wise pattern difficulty level was also very uneven. So we've discussed this through our impression and through our recalls. Also, we've been discussing about how the questions were. Right now, we'll focus more on the takeaways. We've seen previous papers, we've seen our recalls, we've been doing the recalls, we've been giving you the takeaways of each session. Now we'll kind of plan ahead, not just with respect to the resources, but also with respect to how to manage your time. If you're a post resident, post MD person, or in a second, third year, how to manage your time and how to allocate your resources. So this was something I think we didn't discuss because obviously we didn't have the result when we discussed the impression. And also just keep this in mind, because this will come to at the end also. Whenever we discuss about what to read, keep this in mind, right? So you need, obviously nobody is saying, nobody is wanting only top 5, right? In top 20 you got all the branches essentially. So you're targeting 120, right? This is your cutoff, 450 marks out of 600. So you're targeting 120, right? So as Aditya always says, read what is important and read that repeatedly, right? So bar bar padho, bahut zyada mat padho. So that is what is the essence proven yet again. So you have that 1 out of 5 question that you can get wrong. You don't need to get 100 out of 100 or 150 out of 150 in this case. So that let's keep this in mind as we progress through our discussion. And also we'll see the strike rate. We've been discussing the strike rate especially in our recalls, because we don't want to just go out there and say we have this much percent throughout numbers. We've been showing in our recalls, and where we've discussed what question, right? Obviously nobody has 100% recall, nor do we need 100%, right? So yeah, Aditya can take it from here.
Yeah.
How to plan.
So basically, how do you prepare? Let's say you are someone, today is July 11th, if I'm not wrong. Yeah, it's July 11th today.
12th.
12th, sorry. So 12th of July today. And let's say the exam is going to be in December or January. The reason I say, let's say the exam is going to be on in December or January is because if usually when they do their exam, they do the exam just after that particular batch has passed out. So this time the batches, the MD and the DNB batches are going, the DNB batches are going to pass out in October, November. All right. I just had a conversation with one of my juniors. He's there in MAMC. So he's going to give his exam in September. He's going to pass out in October. We had DNB exams in the month of June, but the results are going to pass out. The tenure is going to get completed in October, November. So when the tenure is going to get completed in October, November. Essentially the 3-year tenure is going to get completed in October, November. That's when it's going to happen for most of you. The exam, obviously, unlikely that they will do it prior to December. Most likely, I would keep some date around January, mid-January, late January, or late December. Like that's not even early December. I would like either late December or early January. More likely early January, because late December is usually vacations for most of the professors who are going to make the exams. So I don't think so that's going to happen. So December, January, you can keep December as a target. Now, Vishnu, if you can go back to the original, the first slide, the paper distribution. If you can go to see, one thing I really want to emphasize here, that unlike, let's say, NEET PG, all questions are coming from pediatrics. You're doing one subject. That's the beauty of this exam. Okay. You don't need to get scared. Okay. You're not doing 19 subjects, right? You're doing one subject. Or everything is speeds after all, right? Okay, sure. This time cardio went up. Sure. If you will take past year papers, the trend was maybe 7, 8 questions of cardio. And this time around 15, 16 questions came of cardio. The trend is maybe of genetics a little bit more. This time genetics was a little less. But having said that, you just need to do PEDS. That's the only thing. And for PEDS, what is the book? The book is Nelson. You just need to do Nelson. Like the first thing, as far as your expectation is concerned, Nelson is the king. Simple, plain and simple. Nelson is the king. You have to read Nelson. Now, the problem and the difficulty what people come to is that, can I read the entire Nelson? If I'm not thorough with Nelson, then what do I do? These are the two main problems that people end up having as far as preparing for this NEET SS is concerned. See, if you're someone who's preparing for the MD exit exam, you anyway would be reading Nelson. My simple advice to you would be that anytime you read Nelson, try to make notes. Right? Don't just read Nelson, try to make some notes out of that, which you can revise a little better, so that again you don't need to read the entire bulky book. Okay, it's one book, no doubt. It's one book. It's around 3,000 pages of that book. But it does get exhausting after a point of time. Even Nelson can get exhausting even if it's one book, right? My advice would be simply to make notes. That would be really great. If you're someone who has been, let's say, it has been 2 years since you passed your MD, you haven't read Nelson, you're someone who has not read Nelson well, or you're no longer familiar with Nelson, for example. In that case, what we and Vishnu discussed is you can join the WhatsApp group. We'll give the link of the WhatsApp group towards the end. We will talk about the important topics from Nelson that you should definitely read. All right. Those topics, at least, you should definitely read well from Nelson. And at the same point of time, even if you don't get that list, simply go to DocTutorials app, simply go to the app, simply go to the video section and see the topics that we have covered in the videos. Even simply if you do those topics and read them from Nelson and make some notes out of it, that's actually more than enough. The second way you can go about Nelson is the retrograde method, that you probably would have read Nelson 1 or 2 years ago, or you're reading Nelson right now, but you practice Nelson using the mini test, using the grand test, and using the elite and QRP. All right. So that, I personally feel the retrograde reading of Nelson is something which is going to benefit you a lot. Vishnu, if you can come to the grand plan master slide, if you can come to that, if you want to plan ahead. So if you can remove all this, I would simply say today is July. Let's say the exam is in January. Today is July. Let's say the exam is January. We make a plan from December, from July to January. Let's plan it. The simple goal should be that by September end or beginning of October. All right. And that's when your MD exit exams are also going to be, for those who are, just giving the exams for the first time. You should complete your Nelson. You have good, not even two, I would say around 3 months. 3 months is like 2.5 months seems suddenly feels a little, let's say 100 days, 100 or 120 days you have 100 days to complete your Nelson. You have full on 100 days to complete your Nelson. And I personally feel that's good enough a day, because if you take the important topics of Nelson will somewhere be around 1,500 pages or 2,000 pages. So that means reading around 10, 15 pages of Nelson on a daily basis. And that, frankly, is not a lot. You can definitely devote 2, 3 hours on a daily basis to read your 10, 15 pages and make notes out of that. If you feel tired reading Nelson, then you can always go for the retrograde method directly, where you can, start with the QRP. You can go for the elite test and the grand test and directly do the grand test and then go back to reading the Nelson, which I've already done. So that is That is also one method. If you're going with the antegrade method, give one reading of Nielsen in these 100 to 120 days. And after that, when your exam is done in October or you're done with your reading of in October, the next 2 months should just be practice. The next 2 months from October till December, it should just be practice, practice, practice. Grand test, mini test. So you have your 1 week. In that 1 week towards the end, give a mini test. By day 10, give another grand test, then another 10 days mini test, then another week mini test, another grand test. And we'll also be coming up with the elite test series, which is essentially a test and discussion. So you can use elite test series or mini test to form a schedule, and using that schedule you can revise over the do 2 3 additional revisions by the time the exam day comes. So you can show one schedule of the mini test, Vishnu, if I'm not wrong. Right. So mini test, see this. That's the reason we are starting the mini test from we will be starting the mini test from
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 July 19. So I
July.
just wanted to add one part here. Like, I agree with this particular thing, but over and above that, what you can do is we've planned the mini tests something like from here to here, right? Something like not
Hmm,
there, maybe like something from here to here, right?
hmm.
So here you can give the mini tests separately. You don't need to read that particular topic.
Yeah.
You can go on your own, give the mini test, because that helps in what is called space repetition,
Hmm.
right? You're reading, so you're giving a test of something you might have read,
2 weeks
3
ago
weeks
or three
back,
weeks ago. Yeah.
3 weeks back, or sometimes you might give a test which you might not have read, but you're planning to read the next week. But when you're reading the next week, you know what is important, right? And you'll remember ki, okay, that question had come and that is important, and I'll kind of figure it out how I would have answered that question and understand how to read what I'm reading right now. So mini tests, keep giving them. I think whoever toppers we've talked to this session, the
Session, I
first
yeah.
foremost thing was mini test and
Mini
grand
test,
test.
grand test. See, you have to understand that unlike NEET PG or NEET UG for that matter, uh, you people were people who got really good ranks in NEET PG. Your IQ is already good. You guys are intelligent. You actually, being very honest, you don't need videos to understand. You already know, like, I don't need to teach you cystic fibrosis or I don't need to teach you leukemias in depth. You already have that basic understanding and you have gone to the wards and you have gone to the attended the clinic. So you understand that. What you need as far as NEET SS is concerned is practice of MCQs, repeated MCQ practice and repeated revisions of Nelson. That's it. So instead of focusing on videos, you can definitely take videos and videos can serve as a backup. That this particular topic, I will just do the video, just do the notes of the videos, because you always get the notes with the videos as well. But focus on mini test and grand test. All right, because the more the practice that you do, in fact, we did this podcast with the rankers, and I think both of them, and in fact, pretty much everyone who gave this year's NEET SS talked about how great the grant test of DocTutorials were. Right. So, and the reason they are that good is because two reasons. Unlike NEET PG, we are not going to test you on random obscure fast. They are going to be Nelson based. They're going to be based from the things which are repeatedly asked. They're always Nelson based. They're not too tough. They're not too easy. They're appropriately leveled so that your retrograde revision, your active recall becomes better. So use these mini tests and use these grand tests. For few of these grand tests, we will be having video solutions as well, so that you, in those video solution, me, Vishnu, Divya, they will be discussing how to rule out options, and that's going to help you in the actual exam. Apart from that, we are going to have elite test as well. Elite test you can use to make a schedule. That okay, in this week, elite test is going to happen, and I'm going to complete this much topic in that particular time point, and then the elite test happen. You give the elite test, and then after elite test, uh, in the video discussion of the retest, we'll be discussing how to rule out options, why is that a particular topic important. For example, in this particular session, elite test, I knew that Down syndrome is important. We actually discussed one question related to Down syndrome and leukemia, and three questions came from that one question, and we'll discuss this in recall. We'll be going recalls as well. So I would say that next 100 days, this is the broad one which Vishnu has put out. 100 days is for theory, for reading Nelson, for revising Nelson, and then next 3 months is only and only practice of what you have already done. This will be done with the help of mini test, grand test, and elite test. You can use them whichever way you want. Mini test is for active recall, that randomly you gave a mini test. Elite test is for getting a schedule, and grand test is obviously the, like I said, the actual grand test. So this is the basic preparation strategy that you can follow. we want to tweak it a little bit. We want to talk also about INISS. All right. Now, the thing with INISS is that INISS, unlike NEET SS, INISS, unlike NEET SS, is a near certainty that in November, INISS is definitely October and or beginning of November. INISS 100% is going to take place. There is no chance that INISS won't take place. So, should you start if your goal is, let's say, INISS, should you start preparing for INISS right now? I would say that in these 100 days of Nelson, for that particular sub-subject, for example, let's say you're preparing for PHO, right? So for PHO, read Lanzowski, the one specific book that is there. Let's say you're preparing for NICU, read Ames NICU protocol. Let's say you're preparing for PICU, read Ames NICU protocols or Rogers Intensive Care Handbook. For that particular subject, in these 100 days, give 10 days time to reading of that particular subject handbook. And when September mid occurs, by September mid, they would have September mid or October mid, they would have given you whether the NEET SS is going to occur or not. If the NEET SS is far away, let's say the NEET SS is in, February, or the NEET SS notification itself hasn't come out, then I would say give 1 full month to INISS preparation, in which you're reading just that particular subspecialty. All right, that October till November, you're reading just that particular subspecialty. And then after that, for 3 months, you're preparing for NEET SS. In case they say that NEET SS is going to occur, let's say in the middle of November or in the very beginning of December, in that case, I would say don't give 1 full month to INISS because that will be too much of a gamble. But still give 15 days specifically for INISS of reading that particular subject. So that at least 1 full month, 10 days in the beginning, from July to September, 10 days reading, and another 15 odd days reading towards when you're going to give that exam. Even those 30 days reading with a sound clinical knowledge can help you crack INISS. I'll be very honest about that. So how much to prepare for INSS you can judge depending upon when the notification comes, and if the notification come when they do decide to get the exam done. If the exam is, let's say, not in December, is somewhere in February, give 1 full month to INSS preparation till November. If they say the exam is somewhere in middle November and early December, then probably just give 15-20 days to INSS preparation and not more than that. But as far as subject specific books are concerned, not every subspecialty requires subject specific book. Just just stick to Nelson. Nelson is more than enough. You don't need anything except Nelson. But apart from that, especially for just for NICU, I would say read Ames NICU protocol. But everything else, you can just stick with just Nelson, plain and simple. All right. So should you read specialty textbooks? The answer is no. They are not a must. Just read Nelson. Nelson is more than enough, except Ames NICU protocols. Only for neonatology, you need to do a little bit more in depth. For INISS, yes, for that one particular month that we get talked about, and 10 days in this 100 days, you need to do, if you are interested in INISS. If you're specifically, I'll do another session of how to specifically prepare for INISS if only that is your goal. But for now, yes, for INISS, obviously you need the subspecialty of your choice or super specialty of your choice. But if your goal is NEET SS, stick to Nelson, except NICU. In NICU, you can do a little bit extra reading, but everything else, stick to Nelson. You don't need to go for anything beyond that. Over to you, Vishnu. You can go ahead now.
Yeah, I think few things that I'd like to add is this 100 days Nelson is a proper read, right? Right? Don't think that it's
Yeah.
just a skim through read. Obviously, you can't skim through for 100 days. You have to, get it into you to some extent. It's not like I just, underline it and pass away the page. It's a good read. And if somebody reads in a skimming manner, then I would say you put two reads of Nelson into those 100 days. So that is one thing. And another thing is usually the notification, unless that whole schedule comes, sometimes NB people release a whole schedule of when NEET PG is, when NEET SS is. Unless that is coming, usually the exam date is told around 1.5, 2 months before. So at around this time of, October end, when your one proper Nelson reading, or you can say, good thorough Nelson reading is over, that time you can actually have a particular window to take a decision, because till then, if the NEET hasn't come, if the NEET notification hasn't come, then most likely it's not happening in November. Then definitely it's happening in December only, because obviously there's some rules also that you cannot give an exam date at least 45 to 60 days before it's
60,
held,
60
right?
days, if not longer,
Yeah.
from 60 days is
So
the one.
Yeah, so if till October 1st it's not given, so at least till December 1st it's not happening. So you have a proper window for INSS. Just in case the notification has come, then we can again have, every time these NEET dates come and we have to have a session and guide students because it's so erratic. So that will happen at that point. But till then, definitely go through your Nelson, use your mini tests and your Q bank, and regularly keep giving grand tests. Once you get into the prep, maybe a month or so later, you start off with your grand tests also once in 2 weeks or something. That is our proper goal for the next 3 months. And yes, if somebody, another thing I'd like to add, there are some, not some, in pediatrics there are many of us who do take a bit of a break after MD, who do like to come back into preparation of SS after MD. And sometimes we might have forgotten or Nelson whatever we have read, sometimes we might not have read Nelson in our residency. In those cases specifically, I think the videos are most helpful.
Hmm.
Obviously you will go retrospective to Nelson, but videos you can use it as a base and then go back to Nelson and double down upon it. Also, especially if you have a large gap from your NEET PG exam. NEET PG was the time when we gave a lot of Q banks, when we gave our GTs, when we gave proper exam, MCQ exam with all the rigor. If it's been more than 4, 5, 6 years, then definitely please give a lot of MCQs. Do that MCQ practice, and more importantly, give a lot of grand tests, because you have to get into the grind of giving that test on that 3-hour test. That also is kind of, prep is needed for that. Yeah, so NEET SS INSS pattern, I think obviously everybody who would be preparing would know. These are 150 MCQs of pediatrics. The distribution we don't know. This is 80 of theory plus 20 of interview. The interview pattern depends from, differs from branch to branch. This 80 is divided approximately into 55 to 60 of, specialty,
The
and around to,
subspecialty.
yeah, and 20 to 25 of general. That's how the pattern is. I think everybody would know. And this 150 MCQs, nobody knows. We've discussed how 2023 was, that is this year's, sorry, 2024 was, that is this year's paper. But next time it might be different. Then, yeah, what exam prep to target first? As we discussed, I think firstly, let's wait till October 1st. Keep your
Hmm.
blinders on. Keep reading whatever your special specialty is, give maybe a one hour or something per day, or how much ever you'd like, maybe 10 hours a month or something like that. And then keep that going on to some extent. Maybe read once to some extent your super specialty or subspecialty book. And then once your October 1st comes, you can take a proper decision of whether to go for INI or NEET. So yeah, this thing we've discussed time and again in all my recalls. Of also, I've been saying, if a Nelson is thorough, read well, then no need to look for other sources, right? That is the place where they are asking questions from. There's no confusion about that. There's no second, discussion about that. So if a Nelson is read well, then yes, double down upon it. But if you have not read Nelson at all, then you should consider
Videos.
that you
Videos.
take a retrospective approach, because then you might, have difficulties revising if you're starting from scratch Nelson, because at the end of the day, it's not an unlimited time that we're playing with. Then you have elite and QRP. So wherever I'm seeing our recalls, whenever we are doing our recalls, I'm seeing that some things which we might have missed in our main videos, we are covering in our elite. For example, malaria. For example, some even small facts which one might have missed. Even some updates like Gina updates. Also, I've done a video, but maybe some other update, whichever wasn't there in the main videos, we're covering in the elite and the QRP. So whenever we talk about videos, we don't just talk about the main bank. We talk about the elite TND, which happens every session, Q quick revision program, and the main videos. So target versus strike rate is what we have discussed in target. I've told you the cutoffs that I was telling you. You need to get only 120 out of 150. Correct. Not even marks I'm talking about for the top 20 rank. And strike rate also has been pretty good. We're not going to claim anything. You can go to our recalls and see how we've been discussing. So coming to our practice resources, again, we'll be conducting elite as the NEET SS approaches. You have to do grand tests. You have done all this, right? When we're not, somebody very superior at with respect to cracking exams, because obviously you have cracked NEET PG with good flying colors. That's why you're here, and you have to do the same thing again. But yeah,
Yeah.
it's a little bit tougher this time. But yeah, you have to push yourself to go through that rigor. To some extent, agree.
Exam exam is easier. It's just that it's the third exam. Is people have
Yeah.
people do get a little, like, being very honest. People get tired, going through the grind all over again. Having said that, let's just be very honest. Like, ask any topic. We did this in the podcast also. Like, they said that NEET SS is the easier of NEET PG. To be honest, if you are done with your Nielsen and residency and you can revise it well and do just thorough MCQ practice, you'll come out with flying colors. All right, because the competition, and the good part is that you don't need a rank 1 or rank 10. Even with the top 50 kind of rank, you can still get good for your particular subspecialty. You can get DM or DNB of your DRNB of your choice. So that's always there, right? But I again, me and Vishnu, we I like to emphasize that after the first 100 days, please get back into the practice mode, because reading is something you would have done throughout your residency, and it's something which we do doctors do throughout our life. All right, reading is goes on a daily basis. Practice is what differentiates a topper from an average ranker, right? These QBank and Grant tests and Elite tests are the ones which are going to differentiate. These are the going to be the differentiator. Everyone knows paper is going to come from Nelson. Everyone will read Nelson. The differentiating factor will be how you apply it, especially considering the fact that it's been 4.5 years or 3 years since you gave a MCQ based test. Even your theory exams right now will not be MCQ based. They will just be short answer or long answer questions. So ensure that towards the last 3 months, the focus is on practice and using that practice to revise Nelson rather than doing Nelson again and again and not doing practice adequately. So even like apart from this particular session, I would say the DocTutorial grant tests are the best in the market. No doubt about that. All right. And especially the elite tests, which are created by the faculty, we ourselves created. And when me, Vishnu, they were created, we don't just randomly create it. We talk with the professors in AIMS, we talk with the professors in PGI, we talk with the colleagues who have recently cracked the exam to get to know what other questions which can come. And that is the reason why elite also, even if you go to just 20 questions of elite, 5 or 7 questions might actually end up in the exam, because we have collated those questions from people and resources which either make the exam or have cracked the exam. So apart from the QBank and Gratness, I would always say that use the elite test and discussion as a proper test and discussion and use it to your best advantage possible.
And this is, I think, the secret sauce that the kind of will differentiate ahead. I think this time the toppers, everybody used it, but it didn't come ahead. Like, we didn't talk about it much because it kind of got caught up in the discussion of grant tests, in the discussion of QBank, etc. Because doc tutorials as uh, as a source, we have come properly this exam only, right? So in the discussion of all of it, the praises for the Q bank and the GTs. I think mini tests was what which got missed a bit. But this time, I think you'll see the quality of the mini tests that is there, and also the structure which will help you not only to do MCQ practice but also structure your reading, right? So I think mini test is something that you should definitely not ignore. Super specialty book, subspecialty we've discussed about. Yeah, so we've discussed about how to go about the retrospective approach, why practice is important, especially when you've had a gap since your last exam, and always keep your fundamentals strong. Don't aim for the stars, like like they say, etc. It's a limited time exam. You don't want to keep giving exams being perfect, etc. Don't aim for that perfectionism. By now we all know that it's not the way to go in medicine, right? And then in your second third year, I think there's no doubt about it. Nelson first. This is the best time to double down upon Nelson. It'll help you also to crack your exams secondly, but firstly to become a good clinician and to give your MD final exams very well. And
And
if
I
you're
would
not
say
if
for the second and third years, because sometimes what happens when you come back from the wards, you're a little bit exhausted.
Yeah.
So you might not have the bandwidth to read Nelson. In that case, you can supplement it with the videos.
Yeah.
And you just go through the videos once, and because videos can be a little bit of passive experience. You just put on the video, you're watching it, great. But once you're done with it, then reading Nelson will become very fast. then reading of Nelson after that will become very fast. So if you're someone who has a hectic second and third year residency, in general, PG residency in general anywhere in the country is very hectic irrespective of whichever year. In fact, it becomes more hectic with every passing year. So we know that a residency can be hectic. It must be 7, 8 o'clock by the time you come back. And except maybe the weekends, you will not probably have the bandwidth to read Nelson on a daily basis. So you can use the videos and then read Nelson, because then reading Nelson will become faster because you already know what are the important points from it. So for example, if you watched my leukemia lecture or Vishnu's lecture on JIA, and then you read Nelson, though maybe if you would have read without the videos, it would have taken you 2 hours to read that particular topic, or 1.5 hours. But if you have watched that video of 30, 40 minutes, then you read Nelson, you might just be able to go through it in just 20, 25 minutes. So you can use and supplement videos. But like we will always say, they are supplementary, they are not the main source. Please go through the Nelson always, right?
Yeah, and if you have time in your third year, like some courses might, then maybe you can give a, crack at mini tests, just like, using your phone, your app, and just giving those mini tests on a daily basis just takes 20 minutes. Obviously, don't gorge yourself on that. Just look at how the concepts are being given in the explanation. That's it, right? Q banks and GTs can obviously wait. That is for your NEET SS prep, right? Yeah, so these were the takeaways, and they basically stay the same. These were the takeaways after our NEET SS exam, this particular session, and I think it's almost the same. We went through it more in depth, the questions, options, etc. I think it's more or less the same. I think this is something that we didn't discuss a lot in through this session, this hour. But again, do not do not
Do go
ignore
through the
your
recalls.
PYQs.
Yeah, do go through the topics do get repeated. So even if you go through the recalls of past 3, 4 years, you'll get a broad list of the ideas or the topics which are repeated. For example, let's talk about onco. Now, onco can seem huge from a NEET assess point of view, that we need to do the entire Nelson, but you will realize that they keep on TLS is something which they keep on asking again and again. Right, leukemia is something which they keep on asking again and again, rather than, let's say, asking about random rhabdomyosarcoma or something like that, right? Or they keep on asking about tumor markers rather than asking the tumors per se. So in that case, the topics we keep on getting repeated, and you will have a focused reading of Nelson also if you go through the previous year questions and the recall, and do go through the recalls. That's what we'll advise. We're going through the recall sessions. I have uploaded one video. Vishnu has uploaded one video. Divya will come and we'll keep on doing the 150 recalls as and when we keep on doing the more question. They'll keep on happening over the next 1 and 2 weeks. Yeah.
Yeah, so let's do this. I think if any doubt, and also we talked about the topics each, we thought about doing the topics thing in this session, but we thought it'll be kind of injustice with the time, because even if you want to discuss one particular unit, it takes at least 5 minutes, right? At least 4 to 5 minutes, and it'll be a too long a session. So for the topics of what topics are important each unit wise, we'll be posting it on our WhatsApp group.
Do join the
You can just scan the QR code and you can join our WhatsApp group. And obviously, we discuss our doubts, whatever doubts you have while through your reading, and also we post various tidbits, various one pagers. We post daily MCQs on that, and we also try to, you know, give a deep explanation about that particular MCQ and clear those doubts as well. So do join the WhatsApp group. Uh, yeah,
Thank you.
thank you.
Good night.